Hard to believe, but we're more than 2 years into the coronavirus pandemic, and for a time, maybe it felt as if we were seeing a return to the lives we once knew, free of mandates and safety requirements. Well, perhaps someone should have told the virus about that, because in places, COVID-19 cases are once again on the rise. And that's why we turn to Dr. Lucy McBride. She's a practicing internist in the district and someone to whom we have often turned for medical expertise about all things COVID. Doctor, it's always nice to talk to you.
Thanks for having me.
Where are we right now? Are you seeing more patients?
A lot of patients, people have home testing now, so I'm seeing a lot of people with coronavirus. Just today, I talked about 4 people who have it. Right now, the predominant variant is still Omicron. It's the BA.2 version of Omicron, wildly contagious, no more severe than its cousin, BA.1, but definitely a lot more infections.
If people, for example, are doing a lot more home testing, is it because there's more testing and more people are going, maybe this could be, I think I'll go find out, or is it actually just more cases?
Well, it's both. I mean, I think, people have finally caught on to the understanding of the rapid antigen test.
Yeah.
Rapid antigen tests, I want to be clear about this and put it in all caps. Rapid antigen tests are contagiousness tests. So if you test positive on a rapid antigen test, a home test, that tells you not only do you have coronavirus, you are carrying infectious levels of the virus so that you are at risk for other people.
So you have to deal with it in that respect. Stay home. Don't spread the virus anymore. Do the things that we've known for 2 years you're supposed to do to try and mitigate transmission. But chief among them is you've got to isolate for a time. It's not just, well, I don't feel really bad, so I'll go ahead and go into work or whatever and try and get by. All you're doing is making it worse.
Right. When you test positive for COVID, whether it's with a PCR test or a rapid home antigen test, you stay home and isolate for 5 days. And that's what the CDC says. I go beyond the CDC recommendation and say, isolate for 5 days and leave isolation only when that rapid antigen test, that contagiousness test, is negative at day 5. If it's positive at day 5, you're still contagious. So isolate another day, test yourself at day 6. If it's negative, you can leave isolation. Because some people are contagious even if they feel fine, up to 10, even 14 days. Most people, though, are rounding the bend if they're vaccinated and then boosted by 5 days. The other important thing people should know is that even if you feel lousy beyond the antigen test turning negative, meaning you're no longer contagious, that you're still okay. Like you can go back to work, back to caregiving, back to parenting. If your rapid antigen test is negative, despite feeling lousy.
And that goes back to the fact it is a contagion test. Let's review signs and symptoms here, because it's springtime, so there are a lot of folks walking around with upper respiratory deals because of pollen, colds, that sort of a thing. Short of taking a test, are there ways to differentiate between coronavirus and other things?
Well, that's the tricky thing is coronavirus, especially if you've been vaccinated and boosted, which I do recommend for people who haven't yet been vaccinated or who are not immune. Coronavirus looks a heck of a lot like pollen allergies, sinus infections, the other 4 coronaviruses that we have seen for decades. It can even look like the flu. So this is why testing is so important and why it's great people are able to get access finally to these rapid antigen tests. Certainly, if you walk under a cherry tree and start sneezing, and then you take a Claritin and feel better, that's more likely to be allergies if you are known allergy sufferer. But this is a lot of what I'm doing every day, is helping people parse through those details, and really the testing is the best way.
What should people be doing? I guess if I test positive, if I'm feeling badly, what should I be taking to try and mitigate the symptoms a little bit?
Great question. And it really depends on the person, of course. But in general, for people who don't need to be in the hospital for severe symptoms, and by the way, you're very unlikely to need hospital care or worse if you are vaccinated and boosted, and also if you've had immunity from prior infection from coronavirus. I'm telling people to take Advil or Tylenol as appropriate, hydrate, rest, For high-risk patients who are at high risk for poor outcomes despite vaccination and boosting, and certainly for unvaccinated people who are sick, we recommend Paxlovid, which is the oral antiviral medication that can help reduce the risk of serious consequences. It's not indicated for people who are young and healthy because it's just not necessary. It's also not approved for that use.
But it's also widely available, too. It's not one of those
It's
things.
hard. I tell you, I just got off the phone. I called 3 different pharmacies to try to get it for a patient who's elderly and immune compromised. I finally found it after the 4th call, but it's not widely available.
Okay. That's good to know, too. We're 2+ years into this thing, but it never hurts, frankly, to sort of review, and you've done a terrific job of reminding what we ought to be doing here. And frankly, this isn't one of those things I've heard people say, and this can be the exit question here. People will say, you know what? If everybody gets it and we're vaccinated and we're boosted, we'll get it, that eventually this becomes endemic instead of a pandemic, and it'll just be sort of in, it's like the flu in that regard, I suppose. That's something we can study later on down the line. I mean, right in the meantime, this is a disease that for some people is a very serious situation. It can't even be a death sentence. So don't ignore it. You need to take care of it.
That's right. The best thing you can do for yourself is get vaccinated and get boosted. Talk to your primary care doctor, manage your underlying health conditions. We know that age and obesity are the biggest risk factors for poor outcomes. And then, you want to understand when it's appropriate to mask if you need or want to, when it's appropriate to call your doctor for Paxlovid. These are nuanced conversations, but you're right. This is becoming endemic.
Yeah.
It is going to be woven into the fabric of our lives, not that we want it to. It's still very, very dangerous and potentially lethal for our highest risk patients. But it's something we unfortunately have to manage because the option to mop up the risk entirely is not on the table.
Dr. Lucy McBride, internal medicine specialist, and someone that we really value for her insight and ability to share with us what we need to be doing. Thanks so much for your time.
Thank you so much.
Let's step away for just a bit. If you're an allergy sufferer, maybe some rains this afternoon would help you a little bit, and it seems like that could be a possibility. We'll check your forecast when we come back.